So an eating disorder is a serious mental illness which affects the way somebody feels about their weight, their body image, food. It affects their relationships, it affects their ability to concentrate, to get on with day-to-day life. You can't just tell if somebody's got an eating disorder from looking at them, but if it's somebody that you know and you notice some differences in terms of the way they are around food or the way they are in terms of the way they're kind of eating or exercising, then that might make you to start to wonder, is there something going on that might be an eating disorder? So if it's someone where you're coaching, you might say, you seem not quite yourself recently, maybe overtraining and doing much more than you would do ordinarily. How are you doing? If it's a flatmate, you might just say, what's going on with meals? You might just be able to be a little bit more upfront because it's somebody that you know really well and you're noticing a change. Or it might be that actually what you want to do is to approach that much more gently and with an open question and just check in with them about how they are. Don't dismiss it if somebody's saying, I think I'm, really fat, I think I'm really rubbish. You may know full well that that's not true, but listen carefully and hear that that's how they're feeling. Maybe ask them a little bit more about, is that affecting food? Is that affecting other things? And be there for them. Don't expect a first conversation to sort it. You've got to hang in there and continue to kind of support and to listen. And even if the first conversation goes really well, keep being interested, keep being curious, don't be judgy. Recovery can actually take a long time. Friends and family are absolutely vital in terms of supporting somebody to seek help and also in terms of supporting someone along the way. Someone said to me that without the kind of 2 or 3 trusted friends that absolutely stuck by them, their recovery would not have happened. So professional help in an eating disorder, important, but friends and family, absolutely vital. I think sometimes people, when they're wanting to offer support, can feel really worried about saying the wrong thing. My advice would be that it's much better to ask and it's much better to listen than not to mention it. I think there's something really important to know that your family and your friends, they're interested and they're willing to take that risk because they really care about you. So I guess what is communicated is much more the feeling behind the question rather than getting the words exactly right. If somebody's told you that they've got an eating disorder, what do you do to support them and how do you look after yourself? Firstly, how do you support them? Be there for them. It's usually helpful to find out a bit more about eating disorders yourself so that you can actually know the kinds of things that might be helpful for them, but also know how to help them to access support. And the GP would be a kind of obvious first place to go. Really important to get help early if possible. It helps eating disorder to be something that's recovered from more quickly. Recovery and progress isn't a straight line. It's something that kind of things can go well for a while and then there can be some setbacks. It's a process. This is something that will happen over time. Things can look like they're improving and they are improving, and then maybe things go backwards a wee bit. That's not your fault. It's not something to take personally. Staying focused at recovery can happen, knowing that it's not necessarily a straight line. If somebody's getting help from an NHS team, then it's fine to ask them for advice and guidance and for information so that you work together as a team with a team that's supporting your family member, partner, or your friend. Looking after yourself when you're supporting somebody with an eating disorder is absolutely vital. It's a marathon, not a sprint. It's not like supporting somebody with weekend flu. It's something that can go on for quite some time. So finding support for yourself in that situation is absolutely vital. Otherwise, what can happen is that people become kind of worn down and might start to struggle. And then as they start to struggle, it's not so easy to give help and support. So supporting somebody at mealtimes with an eating disorder, the key thing is to have a plan about the mealtime that's agreed together with the person with an eating disorder. What do they find helpful? Sometimes distraction's super helpful. So kind of agreeing that you're going to have conversations about a programme that you've all been watching on TV. Sometimes people find having other activities to do alongside the meal, like doing a jigsaw or doing a puzzle, can be really helpful. But that will vary from person to person, and you'll know the person you're supporting much better. But the thing is not to be focusing on the meal, not to have conversations about diet, not to talk about your own concerns about body weight, food, or anything like that. So to keep the conversation about something else, and probably to have things to do. We know that autistic individuals can experience eating disorders more frequently. We also know that some of the kind of more traditional ways of working and supporting people with an eating disorder need to be adapted. There's some really helpful work which is described on the Peace Pathway, which describes the way in which you might make adjustments there and take into account people's sensory sensitivities and food preferences, so that actually the kind of the treatment that's offered is much more individualised and much more kind of appropriate. So we know that recovery is possible. That's what we want for ourselves if we've got an eating disorder, or for the people that we love and we care about who we're supporting with an eating disorder. And keeping that sort of recovery end goal in mind is just really important, to keep unholding that hope and that expectation of improvement.